A treatment action campaign TAC audit has revealed that public clinics are doing too little to prevent the spread of tuberculosis (TB) at their facilities. Mary Jane Matsolo from the TAC said the outcome of the survey found that infrastructure is the main issue of the spread of TB.
So the survey was conducted by our branch members that have adopted a facility that is located within their community. The survey was basically a visual survey. Is the infrastructure big or small? Are there enough windows? Are they opened? Are patients seated, separated from, is there a TB unit or is a general unit? Are there masks available? So those were like the questions that our branch members answered and they submitted. Well, what we found is that we're still having infrastructure issues where majority of our clinics are still too small for the number of patients that are walking in and out of them, meaning that it becomes an incubator for TB, because if you've got a lot of numbers walking into a very small facilities and there's not a separation, it's very hard to tell who has TB, MDR or XDR, and usually they sit in the same waiting area, which is another infection risk.
Matsolo said TB is easy to spread.
TB, unlike HIV, is not sexually transmitted. It is an airborne disease, so it's very easy to contract TB. You could get into a taxi. You can contract TB if you sit next to someone that has TB and there's not enough ventilation or windows are not opened. You can get TB at your house if there's a member of the family that has TB and doesn't know that they have TB, you know.
As the country will be commemorating World TB Day tomorrow, Matsolo has urged the public to take care of their health.
We would like to encourage the public to always take good care of their health. Your health is your responsibility. If you are showing symptoms of coughing for more than 2 weeks, night sweats, you're losing weight drastically, go to the nearest facility, get tested for TB, because TB is a curable disease. If you get TB, you get your 6 months treatment, adhere to the treatment, and you will be eradicated of TB.
The TAC says they are calling on the government to play a bigger role in infection reduction if it is serious about control. Meanwhile, in the Western Cape province, 27 fatalities were assessed in March 2018. For our City News, I am Snehlanhla Mnqayi.